Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top medical news. Are plant-based meat substitutes good for health? A recent study published in the American Journal of Clinical Nutrition analyzed the effects of animal-based meat diets relative to plant-based meat analog diets on cardiometabolic health. Plant-based diets have been shown to positively impact cardiometabolic health due to the presence of wide range of bioactive constituents, example vitamins, dietary fibers, carotenoids, and so on. Plant-based diet developed from the sustainable plant-based sources aim to mimic the taste and texture attributed to their animal-based counterpart. With their growing popularity, it is important to critically evaluate their health effects relative to a typical omnivorous diet. The study examined the effects of plant-based diet and animal-based diet on heart and metabolic health in people at risk of type 2 diabetes. Researchers hypothesized that switching to plant-based meat alternatives would improve health and lower disease risk. It was an 8-week trial with 89 participants. 44 were given the PBMA while the rest continued their animal-based meats. LDL cholesterol was the main focus, with other risk factors like glucose levels also assessed.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Plant-based diet more beneficial for brain health, study finds. A study published in the journal Nature Mental Health explored how dietary patterns impacted a number of areas of brain health, including mental health, cognitive function, metabolic biomarkers, and brain structure as measured using MRI. People can develop preferences for certain food, which can impact overall dietary patterns over time. Recently, growing evidence has highlighted the profound impact of dietary patterns on health, including chronic medical diseases such as cardiovascular disease, type 2 diabetes, metabolic syndrome, and cancer, as well as mental health and cognitive impairments such as major depression disorder and anxiety. Previous research has confirmed the significant connection between diet and mental health, particularly cognitive functions. For instance, a systemic review found that a higher intake of simple carbohydrate is linked to lower cognitive performance. Saturated fatty acids are associated with impaired memory and learning, and protein intake may improve executive function and working memory. In the study, researchers analyzed UK Biobank data on food preferences across categories like dairy, fruits, alcohol, and vegetables. The study is how these preferences related to various brain-related outcomes, including mental health, indicators like anxiety and depression symptoms, cognitive function, blood biochemistry, brain structure via MRI, and genetic risk scores for mental disorders. Does prenatal use of acetaminophen raise infants' neurodevelopmental disorder risk? A study published in the journal JAMA Network Open found that acetaminophen used during pregnancy was not associated with children's risk of autism, attention deficit or hyperactivity disorder, or intellectual disability. Acetaminophen is commonly used for pain and fever during pregnancy, considered low risk by FDA and EMA. Previous studies linking it to neurodevelopmental disorders may be influenced by biases like confounding by indication, where reasons for use could be fever or pain and could also be a risk factor for these diseases. Confounding by parental health and genetics is likely because neurodevelopmental disorders are highly heritable, and those who use acetaminophen during pregnancy reported higher prevalence of multiple health conditions associated with neurodevelopmental disorders compared with non-users. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.